Welcome back, everybody, coast to coast, This Week in America. Great to have you with us on the program. Back with us on This Week in America today is Dr. Bobbi Kline. She's a physician, author, teacher, and entrepreneur who is dedicated to transforming healthcare through creating individualized health unique to each person's DNA. She's experienced the power of using DNA to create personalized health firsthand for herself, her family, and her patients. A board-certified Ob-Gyn and functional genomics expert, Dr. Kline has created and taught programs in integrative and functional medicine, genomics, and epigenetics to healthcare professionals, students, and the general public. With Dr. Joe Veltmann, she has co-founded Genomic Solutions NOW and NCG Health Solutions to bring the new approach to healthcare practitioners and their patients around the world. And Dr. Bobbi Kline back with us on This Week in America. Dr. Kline, welcome back to the program. Great to have you with us once again.
Thank you. It's great to be here again.
This is so exciting. And the first program we did, if you go to thisweekinamerica.us, you can listen on iTunes, you can watch on YouTube. We'll do a brief recap and then talk about some new territory on here. But what really has me excited, as I'm reading this, and I'm not a doctor, but I'm reading this and I'm getting excited reading it. Are we on the verge of dramatic changes in healthcare?
I really hope so. That's my goal. And this is a new tool that really helps us look under the hood so we can really see what's going on at a very basic level before somebody gets sick. And it's just, to me, it is really cutting edge and it will transform medicine.
What's it feel like to be on the cutting edge? We've got this evolving technology. You are at the forefront in talking about it and then teaching other physicians about it. How exciting is this for you?
It's absolutely exciting to see the light bulbs go off when we talk about this with clinicians. They say, oh my gosh, and they start thinking of, oh, I can help this patient that I was stuck with. I didn't know what to do, and it gives me new answers and new tools, and they're just so excited.
We'll talk about some examples in the course of the program. Dr. Kline's website is gsnuniversity.com. Go to our website, thisweekinamerica.us, and you can link on directly. Most people would go, I'm familiar with genetic testing, but not genomic testing. Let's talk about the difference, and then we'll talk about some real-life applications for this.
Sure. So genetic testing is what, as you said, what people are familiar with, and it tests your genes, so tests the DNA. So that idea is the same. But when you're doing genetic testing, you're looking for errors that are called mutations in the DNA that are generally inherited, and they usually have a pretty big impact. They cause a specific disease. With genomic testing, we're looking at errors in the DNA also, but they're very small. They're like little typos in your DNA, and they may or may not cause a problem. And what's so powerful about these is that we actually are finding out not only how they might potentially cause a health problem, but how we can potentially prevent that through diet and lifestyle, because we're learning that what we do in our life actually speaks to these genes and can really help modify the potential impact and a potential disease. So it's really powerful because you can do something about it.
It's interesting. You refer to it, I think, as unzipping your DNA at the website gsnuniversity.com. So we can take that information, you can analyze it, you can identify, and you can actually prevent some of the problems that we face going through life.
Yeah, it's absolutely incredible that we have access to this information.
Let's talk about cardiovascular disease. It's the number one killer in the U.S. A lot of people think, okay, heart disease, it's related to high cholesterol. And you say it's not just about the cholesterol. Talk about that.
Sure. So when people think about heart disease, the reason we think about cholesterol is in some of the earlier studies, we noticed that what causes cardiovascular disease are these sticky sites in the blood vessels called plaques. So they're what we find is they're collections of cholesterol. So they're made from cholesterol. So we assume that, okay, if you have high cholesterol, then you get these plaques, they block the arteries, and that's what causes heart attacks and strokes. What we now know is that it's not just about the cholesterol. Obviously, cholesterol is a part of it, but something has to make the cholesterol sticky so that it actually sticks to the side of the blood vessel. And what we're learning is it's a combination of having cholesterol and then what makes it sticky. Inflammation can make it sticky, and inflammation is when your immune system goes a little bit awry and it's a little bit overactive. It also can get sticky if you're having what we call oxidative stress, which is not enough antioxidants. And so you have to have multiple factors in play to then create these plaques that cause the heart attacks and strokes.
Normally, when we talk about cholesterol, we're concerned about a number. And you say it's much bigger than just a number. There's more to the evaluation.
Yes. So when most people get their blood work done for their annual physical, they know they get a total cholesterol number, and then they get subcategories called LDL, which is low density lipoprotein cholesterol, which is supposedly the bad cholesterol. And then you have HDL, or high density lipoprotein, which is supposedly the good cholesterol. And we need cholesterol. I mean, cholesterol is very important in making our cell membranes and making all of our hormones. So we need cholesterol. So there's a balance, not too low, not too high. But what we're finding is that instead of looking at just these basic numbers, it's not just the number of your cholesterol, it's actually, are those particles sticky? And so we have tests now that go way beyond that those basic numbers that can look and see if your particles are of those type that are very sticky and of much higher risk. So somebody could have the same LDL number and have a very different risk in terms of their heart disease.
You're listening to This Week in America. Our guest is thisweekinamerica.us. Information there on our guest on today's program. Back with us, Dr. Bobbi Kline. Mentioned over 20 years experience in women's health medicine, board-certified Ob-Gyn. We're talking about genomics, and we're talking about cardiovascular disease. And a lot of times when we hear that, we focus on a diet, and specifically a plant-based diet. It's something I keep hearing and reading a lot about. Talk about that.
Well, when you talk about cholesterol, there's two main ways we get cholesterol in our bodies. One is through our diet, and only animal products have cholesterol. So if you eat a plant-based diet with no animal products, you're not taking in any cholesterol. The majority of cholesterol that we have in our bodies, we actually make. And so when somebody is trying to lower their cholesterol with and they do a plant-based diet, what they're doing is eliminating extra cholesterol coming in from the diet. And what we've actually found is very recently a study found that your genes, in addition to playing a role in other things, play a role in who develops high cholesterol from cholesterol in the diet and who doesn't. So it's another exciting piece that hopefully we'll learn more about.
When we're looking for diets, you can pretty well find somewhere somebody that says this is a good diet that fits your lifestyle, what you think a diet should be. You could have like all meat if you want, because somebody sometime once published an article or a blog that said, yeah, you can go ahead and do that. Mediterranean diet is one of those that I hear a lot about as well. Talk about that, and is that something that's helpful?
Mediterranean diet has been one of actually the best studied in terms of looking at from a research standpoint, and it does have a lot of benefits. One of the challenges is what actually is a Mediterranean diet, and I think there's a lot of different interpretations, but it's mostly plant-based with small amounts of fish, maybe small amounts of local dairy, and a lot of olive oil and a lot of herbs and spices that have what we call bioactives in them. And these bioactives talk to our genes in a very positive way. And so for that reason, we're finding in a lot of situations the Mediterranean diet actually is very helpful.
To be really helpful with what you've discovered and what you're working on, genomics, you need to get this out to physicians, to doctors, to the medical community, and you're doing that, an ongoing educational effort. You've got a case study that's interesting. You were working with a cardiologist, and you used genomics to help a woman. I mentioned before the practical application. Talk about that, because in this case, this was life-altering for the patient.
Yeah, it was terrific. So this patient actually had heard about the genomic testing and contacted us and wanted to use it. So we got in touch with her cardiologist, who was new to genomics and was willing to explore this for her patient. This patient was in her mid-40s and had been struggling with high cholesterol. She was very educated in terms of health, what to eat, what not to eat, lifestyle. She was doing all the right things that we think about. And she still could not get her cholesterol down below a certain point. And this cardiologist had done that special cholesterol test, and she did have a lot of sticky particles as well. So there was a real concern here, and the patient did not want to go on a statin, which is often recommended. So the cardiologist said, "Okay, let's get some other answers." And so when we got her genomic testing, it was just eye-opening, and for several reasons. As I said before, a lot of the cholesterol in your body is made internally, and it's actually made in the liver. And the liver has a special pathway and special receptors that sense how much cholesterol is out there in the bloodstream, and then decides, do I need to make more cholesterol or less? And what we found is this patient had a SNP or a typo on the gene that codes for one of those receptors. And so what was happening is, even though she had higher levels of cholesterol in her bloodstream, her liver was not getting that message. It was getting diluted. And so it kept making more cholesterol. So actually she, by doing all the things that she was doing, had done everything she could to get her cholesterol as low as possible. It wasn't going to get any lower. Just physiologically, she could not get any lower. So then we looked at these other areas that we talked about, the inflammation and the oxidative stress. And what we found is she also had a lot of typos or SNPs in these genes in some of these other areas. So what it did is it validated the fact that if she had not been so diligent in being an advocate for her own health, she probably would be dead. And that was very affirming to her. And it also let her know that, and her cardiologist know that this is about as good as you're going to get in terms of your total LDL number. So that's not going to be, we're not going to keep hammering you on that. Let's focus on these other aspects that were making your cholesterol sticky and there were specific dietary changes we made and some nutritional supplements that we recommended to make her cholesterol less sticky. And so this is something that will make an absolute difference in her life going forward.
I'm thinking when a doctor says you would have been dead, I said life altering. Yeah. This actually was life extending by doing this.
Absolutely. Absolutely. Because the cardiologist was at a dead end. She didn't know what else to do other than giving her a statin, which sometimes can help. And actually for this patient would not necessarily have been a bad thing. But she didn't want to do that. And so let's work with the underlying physiology and biochemistry in your own body to really optimize your systems. And she was so grateful to be able to have these answers and now have a more specific blueprint as to what really she needed to do beyond what she was already doing to really hopefully have a long and healthy life.
Dr. Bobbi Kline, our guest on This Week in America. The website for information is gsnuniversity.com. Linking on to thisweekinamerica.us, you can link on directly to Dr. Kline's website. Talk a little bit, a few minutes left in the program, about the actual testing. If somebody is listening and going, this really makes a lot of sense, I really want to get more information and would like to do this, how do we go about getting testing? Is it an elaborate procedure? Is it painful? Is it something we have to do on an ongoing basis?
It's actually really easy. Most of the genomic testing done nowadays is just done with a cheek swab. So it's very easy. We have young children doing it, and we have people in their 70s doing it. So you can do it at any age. And we don't know at what point your genes don't change. What we think is in the very early years of your life, you can still develop new SNPs. But probably once you're around 7 or 8, and we're still doing some research to define this better, your genes probably don't change unless you undergo a major stressful situation like extreme famine or something like that. So once you have your genes tested, you don't need to get them tested again unless more genes are available and you want to test for those additional genes. The other piece is the information is changing all the time. So if you do get tested, even if you don't need to get your genes retested, it's probably a good idea every year or two to get updated information if you can, because it may be new and it may be different.
Can you change your genomic destiny? Is that possible to alter that?
It is, and I think this woman that we were just talking about is a perfect example. That with her genes, she really was destined to have a heart attack and potentially die at a fairly early age. And her diet and lifestyle made a difference. And then by knowing her genes, she was actually able to target that even more and really change the outcome.
How do we bring this up with our doctor? In the case of this lady's in with the cardiologist, and they reached out to you and you were able to give them, again, life-saving information. Sometimes it's awkward to bring up to a doctor something that they're not aware of or something that's not part of their regular practice. How do we go about bringing it up to them? Because it is our life that the doctor is dealing with.
Absolutely. And what I recommend to patients is a couple things. One is if you're curious about this, try and maybe learn a little bit about it yourself. And we do have some resources for that so that you come in to your physician with some knowledge. And then you can tell them, I've heard about this and I want to get this done and this is why. And I'd really like you to help me. Some physicians are afraid to do something that's new that they're not an expert at. So if your physician is new to this, you can let them know, look, I know you're new and that's okay. I'm willing to work with you if you're willing to work with me. And one of the things that we do is really support clinicians who are new to this because it is scary and you want to make sure that you're giving the patient the right information. So we do give clinicians a lot of support in that to try and help them in that process.
And we're talking about genomics. I made the mistake of saying genetics, which everybody does, but get the two terms correct before you go talk to somebody. Information at the website gsnuniversity.com. Dr. Bobbi Kline, our guest in the program. A minute or so left. It's interesting as we do more programs in talking with medical people, they're sort of taking the approach that you did a while back, which is I'm tired of always being reactive. I would rather be proactive. And doctors that were saying, I'm frustrated because all I was doing, and it's actually all I was taught, was hand out drugs. And I really didn't think I was making a difference. Do you find that as you're talking to doctors that they're receptive because it's like, I really need to go a step further than just what I was taught and hand out pills to these people?
Absolutely. And I think there's a huge movement in the healthcare community where professionals are frustrated. I think the challenge is that often they feel they're on a treadmill and they don't know how to get off. They don't know how to find the answers. And that's why, we're trying to help them and trying to make that process easier. But it is a challenge. And right now it's a minority of healthcare practitioners that make a transition from being frustrated to then actually taking action. But I think it's growing, and the more that people demand this from their healthcare practitioners, the more the system will change.
And it's interesting because you can relate to them because you went through some of the frustrations they're going through. They can relate to you because you went through those frustrations, took some steps, did something about it. And it's an excellent website, gsnuniversity.com. Our guest on the program, Dr. Bobbi Kline, wanted to talk about osteoporosis. Not going to have a chance to do that because we'd be here 3 hours to cover all the exciting things that the doctor is talking about. We will have Dr. Kline back to talk about that. It's always a pleasure to have you on the program. Some really great information. If you're listening, need more information, go to gsnuniversity.com. Dr. Kline, thank you so much for being with us once again.
Thank you, Rick. It's been a pleasure.
You're listening to This Week in America. Information on Dr. Kline available at our website, thisweekinamerica.us. Program continues after these messages. Stay tuned. Coming right back.